Hi, I'm Dr. Kathy Maupin. I am the medical director and founder of BioBalance Health. I'm here with Gloria Reilly, who's one of my patients, and I've asked her to come and talk to us about her experience with BioBalance pellets, how she's feeling on them, and she's been nice enough to come today and join us. How are you? Welcome.
Thank you. Thank you for having me. I'm happy to be here.
Good. So I was wondering if you can go back to how you got to the point of using pellets. I know that we had tried many other things prior to the pellet therapy. So could you tell everybody what you tried and how you responded to it before we got to the pellets?
Actually, it was a series of sublinguals and creams, and that was about a year of trying that.
Other bioidenticals?
Correct. And I just wasn't getting any relief. A little bit of relief, but not entirely. Mm-hmm. And so one of your nurse practitioners and you also recommended the pellets, and I thought, why not? It sounded very easy, and it was another avenue that sounded like it would work.
And how did you feel before the pellets, or before any of the hormones that you were trying?
Many sleepless nights, irritability, just being uncomfortable, the hot flashes. I just wasn't myself at all, and I knew that there had to be something that would work for me.
That's a scary feeling. I've been there as well. So when we inserted the pellets, and you started to feel better, can you take me through that first month or so as things changed and what the outcome was?
Sure. Within 2 weeks, I started actually feeling some relief. The hot flashes subsided somewhat, early on within 2 weeks. I just felt like I had more energy. My balance was back because I felt like I was a little bit off kilter before that. And really within a month or a little bit longer, I just felt like I was just before menopause, before any of it began.
Awesome. That's great. And you were post-menopause when you started this?
Yes.
And sometimes that pushes us to try to find an answer to everything. The balance thing is very interesting because I've had several patients have the balance return. And I investigated it and researched it, and it turns out that testosterone is one of the things that helps your inner ear give you balance. And so as it drops off, it's not the estrogen portion, it's the testosterone. As that drops off, people lose their balance. It's one of the reasons why in nursing homes, when people have no testosterone, no estrogen, as they're walking around, they break hips because they fall, not because their bones are maybe thin, but not just because of that, but their balance is gone. So it's very good that you have your balance back. Then you can ride bikes or do whatever you want to in terms of sports or activity that I would feel I couldn't do if I didn't have my balance.
Well, and one of the actual things that I do as an outlet is yoga, and that just made a huge difference. I was able to do it prior to the pellets, but obviously much better and more confidence, and I just knew that I wouldn't fall.
And that's so good for you. I mean, the yoga is something that people use to heal and feel better and balance themselves.
Very true.
In your work, has this changed anything? I mean, have you noticed yourself to be more productive or?
More productive, more patient with clients and actually my peers as well. And I can pay attention more, hold my attention better.
That's great. Now, many times people lose weight. You look like you've always been thin, and I don't remember that you had any more weight on than.
Actually, I did.
Okay.
Yeah, I mean, I've never really had any weight issues, but I noticed that I was gaining some weight around my middle, and was concerned about that because it was something that I never had to. And with the pellets, it just pretty much came off. So that was a relief.
Did you have to do any dieting, or did you just eat normally?
Eat just normally like I normally do, but I just kind of pumped up the exercise a little bit more. But I think the pellets did most of the work, actually.
Well, that's great. And you look wonderful, and you look like you feel wonderful, and you have your confidence back. It's so nice to have that. Well, I think you're a perfect example of what the pellets can do for people. And do you have anything else you'd like to tell the people who are wondering whether they should try this or whether they should spend the money on themselves in this way?
I do. I think it's actually money well spent. It's for your health and well-being, give it a try. I don't know of anyone that it hasn't worked for, and it's certainly a process to figure out, which pellets and which, formulation, and something technical that you can speak on, doctor, but absolutely.
And that's true. I'd have to say it's 1 out of 5 that we get the dose perfect on the first round. And then usually we figure the dose by the lab, but then we insert the pellets and then come back and we have another blood test and a meeting and decide how to tweak it. And it takes a little while. It's not just here, take this and you're better, but it is something that we work on so that we can get to the right spot for you.
And I do feel that I'm at that point.
That's great. That's great. Thank you so much for coming today and talking to us, and I hope it brings a lot more patients to be able to say, I want to try this and I want to be healthy.
Well, thank you for your time and all your hard work.
Oh, thanks. It's always a pleasure. So if you'd like more information about BioBalance and our pellet therapy, then you can go to biobalance.com or call us at 314-993-0963.